So New South Wales recorded 35 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. 29 of those cases were linked to previously confirmed cases, with 14 of these being household contacts. And 6 cases remain under investigation, and we had 5 new cases were acquired overseas. In essence, the testing numbers were 56,331, so down slightly. And again, can I redouble my request for people to come out and get tested? The sooner we can detect any unrecognised chains of transmission, we can slow the spread of this virus and move back to a position of no community transmission. Every person who tests positive, by coming forward early and not delaying, so at the earliest point you get symptoms, please come forward and get testing. Because what we're finding is that this virus spreads so rapidly in your household that when you test positive, a few days later or even at the same time, we're seeing the rest of the household turn positive, and we want to reduce those risks in the community. Of the 35 new locally acquired cases, 23 were in isolation throughout their infectious period. A further 3 cases were in isolation for part of their infectious period, and 9 cases were infectious in the community. 6 cases remain under investigation. So what we're encouraging you to do is to minimise your retail going to shopping, minimise as much your exposures in indoor settings. Stay socially distanced. I was pleased that I did get some groceries this morning and picked up some bread, and it was fantastic to see that community lining up, many wearing masks, because we've also indicated even if you're in an outdoor environment and you anticipate you can't socially distance, wear a mask. It was pleasing to see everyone politely stepping back, giving people distance as they were waiting for those takeaway coffees. And I just urge people to minimise their exposure in places like retail and supermarkets over this weekend. Instead, go for a walk in your household group around the block. You can go to your local park, but keep a distance from anyone else. We want to make this, we really appreciate the community's compliance with this, and I think the community understands the difference between indoor exposures, not being tempted to have people over to your house, whereas we're giving people a bit of freedom to walk around the block in a household group, go down to the park, stay in that household group, to give them a bit of reprieve. Thank you. In terms of the cases today, I just wanted to, there has been a lot of discussion around the healthcare exposures, so I thought I might just take a moment just to describe a sequence of events. So New South Wales Health identified a student nurse who tested positive on the evening of Tuesday, the June 29th, and this case was announced on Wednesday because she'd worked whilst infectious at Fairfield and Royal North Shore Hospital. Testing of her close contacts identified an additional 8 cases across 3 linked households, and of those, 5 worked in aged care and healthcare, and 2 had worked at Summit Care in Baulkham Hills whilst infectious. 1 had worked at Royal North Shore, Royal Ryde Rehab Hospital and Fairfield Hospital while infectious, and the others had not worked whilst infectious. Follow-up investigations at the healthcare facilities have identified 2 further cases at Royal North Shore Hospital, including one of today's cases, who was identified as a close contact of the student nurse. This case did not work whilst infectious was fully vaccinated. And there are therefore 2 cases who acquired their infection through healthcare exposure, but both had not worked whilst infectious, and that's the rationale. If we can detect cases, we can then remove them from workplaces and make sure we don't see ongoing transmission. We're obviously very watchful, and I appreciate the efforts of staff, but also patients. We're doing regular testing in those facilities because, as you know, we need that full 14 days to ensure that there wasn't transmission from those healthcare worker exposures. In terms of other settings, I'd like to just highlight is I want to just give a big call out to some people in the Central Coast who had acquired the infection through exposure at Ocean Foods. We didn't have their details, but they'd watched the media and followed the health advice. So when they tested and when they came up positive, they'd been isolating for the full period and posed no risk to the community. And I think that just highlights the fact that we need to work together as a team, but I just really wanted to extend my appreciation to those individuals. In light of the community transmission in Auburn, New South Wales is advising anyone who visited Auburn Town Centre on or after the 27th of June to get tested for COVID, even if you do not have any symptoms. People with no symptoms who have not been to close or casual contact venues need to really maintain as much as possible that isolation, but obviously can go for urgent healthcare visits and other things. So we are asking for a really strong push in that Auburn community, particularly those who've been around the Auburn Town Centre, because we have seen some cases where there may have been exposure in that environment. We've also had a detection in the Penrith sewage treatment. Now, there may be an explanation for that in the sense that a worker worked there for a short period of time. However, with repeat testings also come up positive. So we do want to call out the people in the Penrith sewage treatment plant area. So that's Cambridge Gardens, Cambridge Park, Leonay, Emu Plains, Glenbrook, Penrith, South Penrith, Glenmore Park, Jamestown, Regentville, Lapston, Orchard Hills, Kingswood, Castlereagh, Cranbrook, Lanedo, Sun Valley, Mount Riverview, Emu Heights, Jordan Springs, Mulgoa, Warramoo, Blaxland and Yellow Rock, as well as in the Blue Mountains National Park, to be particularly vigilant and come forward and get tested at the earliest point. So as the Premier said, it's pleasing to see that testing numbers have remained high. It's pleasing to see we're seeing more people infectious, less numbers of people infectious in the community. And obviously we're seeing, because of the lockdown, that the settings in which people have unknowingly been infectious in the community are much lower risk settings. But it does highlight the fact that we need everyone, as we move about, to make sure you assume that the person next to you has COVID. So please stay with us on the journey to get to that no community transmission.